Con Family Viewing.
Focus on Health, your weekly dose of health and wealth information on KUTV.
Welcome to Focus on Health, where we educate you on matters health. My name is Bwari Michelle. World Tooth Day celebrated every year on the 9th of February. And as you can see today, we are here at Bliss Medical Hospital at their dental department. And our topic today is going to be dental hygiene and halitosis. Halitosis is commonly referred to as bad breath, and no wonder we have so many gums and mints in the supermarkets. But this is just a temporary solution. So Dr. is going to be guiding us on the most permanent solutions on dental hygiene and halitosis. But even before we see Dr. on that, here now is a health update. Focus on Health. So with me on set is Dr. from Bliss Medical Center, and our topic is dental hygiene and halitosis. Welcome so much, Dr. to Focus on Health.
Thank you.
So Dr. maybe you could even introduce yourself to our viewers before we start.
Okay, I'm Constance Chebet-Cheruiyot. This is Bliss Medical Center. Yeah.
Thank you very much. So Dr. our topic today is dental hygiene and halitosis. Maybe you could guide us through these terms. Halitosis, we've never even heard of such a term for most of us.
It is the practice of maintaining the oral cavity and the mouth clean.
Okay. What about halitosis?
Halitosis is the bad breath.
Okay. Thank you very much, Dr. So Dr. now here we are at the dental department. We have a patient. Maybe you could guide us to, knowing what are the first steps that you take when the patient comes to you and, you have to now diagnose.
Okay. Now comes my patient. She's called, your name please? Okay, well, the first thing we normally do to our patient, to our dental patient, she comes in, we do the consultation. Now the oral examination, we need to examine what the patient is feeling, then we give now the final diagnosis. Yeah.
Very informative, Dr. Maybe you could head on to that.
Okay. Hi, Nancy.
Hi.
I'm Constance. Welcome to dental. What is the problem today?
I'm here for a normal checkup.
How do you feel?
I feel pain when I check my legs. Yeah.
For how long did it started?
Like 2 months ago.
But did you make any attempt to visit any dental clinic?
Not yet.
Not yet. So it's good you come for dental checkups, even once in a month or after every 3 months. Just come, we do the checkup and the rest. So for now, I'll have to check your mouth. So you need to open wide. You need to be done some cleaning. You have some strains on your teeth. Now there is one which has a cavity. We need to do some filling. Now another one, you have a gap here. You have a missing tooth. You need to do a replacement. in that if you don't do a replacement on this side, you see the opposing tooth on the upper side, it will tend to supra-erupt. So you need to come, we do the services. Okay. Yeah.
So Dr. that's basically the first procedure?
Yes.
Okay. Maybe you could tell us what is the importance of that particular procedure?
The importance of doing the checkup before you proceed with any service you give to the patient, we do the oral examination.
Okay.
Now we check the patient. If the patient has any problem, now this is the right time. We'll tell the patient we need to do this and this.
Okay.
Yeah.
And Dr. what are the consequences of maybe not going through, with this procedure, regular checkups like you said?
Okay, there are some many causes which may lead to not coming for dental checkup. Either you can get some cavities, you get some bad breath, you have some missing teeth, the retained roots, you end up losing many teeth.
Okay.
Now you become edentulous.
So now, Dr. that you've mentioned bad breath, you've actually taken us to our topic today, which is dental hygiene. Maybe you could tell us, what are some of the practices that you would encourage us, even our patient here, to do in order to maintain dental hygiene?
Okay, the practices we normally advise the patient to do is to maintain good oral hygiene.
Okay.
This is by brushing well. You take 5 minutes brushing. Now after that, there is a mouthwash. You need to rinse your mouth with it. Then brushing, you need to brush twice in a day, especially for those who normally go for work. You brush in the morning after meals, then in the evening before you sleep, you brush well.
Okay.
Yeah. Then after brushing, there is something called flossing. Flossing, that is a type of a thread. We normally remove food or any particles which during brushing it can't come out. So you use now the floss so that you can remove all the food debris in the mouth.
Okay.
Yeah.
And Dr. you've mentioned brushing twice a day, and some people say that actually brushing at night is the most effective. Why is that?
Yeah, normally we advise patients to brush during the night before they sleep, in that the bacteria normally work during the night. Yes.
Okay.
Yeah.
And what exactly happens, after maybe the bacteria works during the night?
Oh, normally we have the sugars which are in the mouth, they break into acid. The bacteria break the sugars which are found in the mouth, then they become acidity.
Okay. So maybe even for a patient who said maybe has a few cavities, you can recommend maybe like brushing to avoid, cavities, existing.
No, already when you have a cavity, you need to come, we do something called dental filling.
Oh, okay.
Yes. If at all you have a cavity, then you brush well. Okay, the extent of the cavity won't prolong. It will stay like that, but we need to do some fillings. We restore the tooth. Yeah.
And how often should one replace their toothbrush?
After 3 months. Now again, when you have some cold or a flu, you need to change your brush. Yes.
Okay. Dr. we have maybe various types of foods that you should avoid and even those that you should eat. So maybe you could guide us on which types of food will, help you improve your dental hygiene, and even those that will make it, now become worse.
We have the dietary habits. For a patient, we need to advise the patient to eat less sugary food. Yes. Like if at all a patient, for kids, we normally advise the kids not to take anything sugary, or if at all they take the sugary things, they need to brush immediately. Now for adults, we need to take more of carbohydrates. We leave the sugary things like biscuits, sweets. But if at all you are somebody who likes snacking a lot, we have the sugar-free gums in the supermarkets. You can use that. That is advisable.
So, Doctor, you've told us about the importance of brushing our teeth. Tell us about the tongue. Why is it important to brush our tongue?
The importance of brushing the tongue, this will help us to avoid the bad breath and even getting the tonsillitis. Yes.
Okay, so Dr. we have babies, and you can't really brush your baby's teeth. So what can you do to ensure that even the dental hygiene is checked?
We normally recommend the parents of the babies to assist the babies on how to brush. Like if the baby is very young, 0 to 2 years, they can take something clean, they wipe for the babies. If at all the baby takes a lot of medication, after taking the medication, the baby is allowed, the mother or the guardian of the baby needs to wipe the teeth of the baby so that the mouth of the baby remains clean. Yeah.
Dr. Traditionally, we've seen even our grandmas, maybe they, instead of using a toothbrush, they use maybe a stick and they have maybe salt and they don't use toothpaste. Is that really effective, or does it even help maintain dental hygiene?
It's effective in that normally when you backdate our grandparents, or even our parents at home, they normally use that. But when you do some survey, they don't have the cavities. That is recommended. If at all you can get it, you brush well with it, no problem. There's no harm.
Actually, maybe now you could guide us through measures that, maybe are preventive to ensure that you don't get diseases and also to improve your dental hygiene.
First, you need to come for a checkup. Then after checkup, you need to brush well. You check the food we normally take. Yeah.
Let's talk about prevention. How do you prevent these diseases arising from maybe negligence of dental hygiene?
Prevent eating habits like sugary things, snacking a lot. You recommend it to the patient. That is very alarming to them.
So Dr. let's say you've practiced all these good measures that you've said. Is it possible to actually still get these diseases afterwards?
Yeah, you can. If at all we restore everything, we do all the services you have in your mouth, but you don't stick on good brushing, the problem will come back to you. That I cannot guarantee you that everything will be well to you, but you need to be coming for checkups at least even 6 months after every 6 months. Yeah.
So maybe, Dr. you could hold on to that thought. We're going to take a slight commercial break. Do not move a muscle. I'm going to leave you with the Did You Know segment. Continue following us on our social media platforms on Instagram, Facebook, and also on YouTube at Focus on Health. Leave any questions, suggestions, and comments. We'll be right back.
KUTV, in conjunction with Kenyatta University Funeral Home, is now offering death announcements immediately following our news bulletins at 7 p.m. At this sorrowful time, as you share in your grief, allow us to communicate your announcement of your loved one on KUTV in both Kiswahili and English. For more details, kindly inquire at the KU Funeral Home Service Desk or call 0736 928 380 or dial 020-359-9054.
When Tracy Patado, we normally distribute flyers, supermarket, mall activations, roundabout activations, campaigns, na bado we do marketing. If you are a fast learner, you can take around 4 years to 5 years. Ndio kuwa strong out the street. Pale, kingia kwa barabara, you're a driver, na focus. Sikitoro utaambiwa, wewe usisikize. Wewe ni gari, wewe ndio dereva, na wewe ndio gari bado.
With the advent of the coronavirus pandemic, automation of services became very attractive.
Many of these retail stores, whenever they want to order an item, they have to close the shop, go to a wholesaler, get the items, come back. In the meantime, he has lost customers. Duka is a tech company. So we use tech to make the life of the shopkeeper easier.
Duka has become now a delivery organization after you shop, which means you have a shopping app. And what you want to do is that as long as you've logged into the Duka app, the charges are being absorbed by us.
Welcome back to Focus on Health, and we truly appreciate all the positive feedback we're getting from you on our comment section on Instagram, Facebook, and also on YouTube. We have many comments, we have many queries for Daktari, and we're going to get back to you on that. So Daktari is here with us on set. Our topic today is halitosis, also known as bad breath, yani harufu mbaya. And Daktari is going to be telling us how to get rid of that, halitosis. She's going to be showing us one way of getting rid of it. So Daktari, maybe even before we start, some people are always asking, now Daktari, you've come, kuna a patient, she has bad breath. Do you always have to smell the breath to test it, or is there maybe a machine that you can use to test whether the breath is bad or not?
Michelle, what we normally do to a patient who comes with bad breath, we normally hear what the patient says. There is nothing we are doing about the patient, but if at all the patient says she or he has a bad breath, we normally tell the patient there is a procedure we normally do, and you need to take good oral hygiene, you need to brush well. The first procedure we normally take in a patient, we do some scaling, that is full mouth scaling. Then if at all we do after that procedure, we advise the patient to come for checkup after 6 months. Then if the bad breath persists, we normally send the patient to see the Daktari to check him or her on the GIT.
Okay, so maybe Daktari, I could leave you to do that, because I'm sure even our viewers are excited to see how this scaling goes on. If you could kindly proceed.
Thank you. This is a short procedure. We normally clean tooth per tooth that way. So you open your mouth wide.
Wow, that was really interesting, Daktari. I felt as if I was actually going through the procedure myself. So Daktari, that was scaling. Maybe you could tell us what exactly was happening, because I saw as if you had maybe something that had some water. What exactly were you scaling out of the tooth?
Okay, that procedure was full mouth scaling. I was just removing the tartar. If at all there was some food inside or some stains, now we clean it. Anything with the brush, during the tooth brushing, doesn't remove it, we do the scaling. Yeah, and that's something for water. You were seeing that is a suction tip. It withdraws the water from the mouth so that the patient doesn't swallow. Yes.
And what is the importance of maybe the mouthwash that you use much later after the process?
That is now for the rinsing, and it is antibacterial. So it's recommended, if at all you go home, you need to be having one. Yes. After every brushing, just gargle the mouth.
So Daktari, maybe to get the process clearly, you did the scaling to the teeth. What about the tongue? What can you do to it?
That sounds interesting. For the tongue, we don't do the scaling, in that it will be very harmful. Then we'll be forming some irritation in the tongue. So we don't do the scaling. We just advise the patient during brushing, he or she remembers brushing the tongue each and every time.
Okay. Now, Daktari, that you're done with the procedure, maybe even for our viewers joining us right now, we could start by defining what is halitosis once more.
Okay, halitosis is the bad breath. This normally comes from our oral cavity or our mouth.
Dr. What exactly causes this bad breath?
The causes of the bad breath is poor oral hygiene, in that you don't brush well. Again, the food we normally eat, we need to focus on it very, very strictly. Now another one, we need to be coming for, if at all you don't come for dental checkups, you need to be done some medical examination that exactly cause it.
Dr. How exactly does halitosis manifest itself? How do you tell that you have bad breath, or do you just have to wait for someone to tell you, your breath is not really okay today?
Okay, for the signs and symptoms for the halitosis is that a neighbor can tell you that your mouth doesn't have good breath. There is something I'm feeling that comes from your mouth. Even the patient might feel it. There is something not good at all.
Dr. Maybe you could take us now through the diagnosis of halitosis.
We normally hear what the patients, the presenting complaint of the patient first. Then after that, if at all the patient has the halitosis, we ask the patient for how long does that bad breath has stayed for how long. Now that will give us way forward on how to do it. And simply that, we normally do the scaling. Then we advise the patient after 6 months to come back. We do the checkup. If at all the halitosis persists, we may send for further consultation to see Dr. If there is a problem on the GIT, Dr. will help the patient.
Okay. So Dr. Now that you've mentioned GIT, does that mean that it can actually go beyond oral hygiene?
Dr. will tell us after eradicating, after doing the full mouth scaling. Now if it persists, we refer the patient for
the checkup.
Yes.
So Dr. You have people who maybe complain that when they take garlic, when they take onion, it actually affects their breath, but they still have to have it in the diet. How can we go about that?
Okay, in a situation like that, we cannot avoid eating our meals without onions, garlic, and the rest. We need to eat them. It's very healthy. But now, after eating, you need to brush.
What about water? Would you recommend it when it comes to the prevention of bad breath?
After brushing, now you have the mouthwash. It is recommended. Now you do more of flossing each and every time.
Dr. Maybe now you could tell us about the habits that you encourage us to take in order to maintain good breath, fresh breath every day.
I normally advise for alcoholic people, they need to reduce their alcohol, or they brush well. After taking the alcohol, if they're intoxicated, before they sleep, they need to brush so that the bad breath can go away. Even for those who are smoking and tobacco, they just need to leave it or just reduce.
Okay. And maybe now, Dr. You could even take us through the treatment. How do you go about the treatment of halitosis?
Treatment is only the habits. You need to watch on the habits. Then the brushing. Again, for the checkups, you need to be coming for checkups. Yes.
Dr. Can halitosis go beyond oral hygiene generally?
I normally advise for alcoholic people, they need to reduce their alcohol or they brush well. After taking the alcohol, if they're intoxicated, before they sleep, they need to brush so that the bad breath can go away. Even for those who are smoking and tobacco, they just need to leave it or just reduce. They need to come for checkup. We do the scaling the way you've seen what I've done to my patient. Then we normally advise the patient if that bad breath persists, we have the gums. The patient can chew the sugar-free gum that will assist the patient. If at all the bad breath persists, the consultant will see the patient, then they will give the patient the service it requires.
So Dr. when I was just doing my research, I came across something about, people who complain that they have dry mouth. So there's something about the saliva maybe not being produced in plenty, and that affects them and even causes bad breath. How do they go about it, or rather, what can you do about that?
Oh, that one it's called xerostomia. That is now the dryness. Okay. If the patient lacks saliva in the mouth, we normally introduce. If the patient have insufficient saliva in the mouth, we normally tell the patient, we encourage the patient to chew a lot Yes.
Now we could get your final remarks. What would you tell our viewers generally about halitosis, about dental hygiene? Give them advice on how to be on check when it comes to these things.
Okay, what I can tell you, my viewers, is dental is something very important. If at all you don't have any problem in dental, in your oral cavity or in your mouth, just come. We do the checkup. We see. There's no one who is perfect. We need to check our mouth daily. If at all you come after every 6 months, it is allowed.
Okay, thank you very much, Dr. It's been a pleasure having you on set, and we're looking forward to doing more and more interviews with you when it comes to dental. So we've come to the end of our show today, and there you have it from Dr. You always go for regular checkup because dental hygiene is very important. It boosts your confidence. You can smile with confidence. You can talk to people without not worrying that, hey, my breath might be a bit bad on there. And so make sure you also follow us on our YouTube channel, on Facebook, and also on Instagram. Leave all the comments over there, any suggestions and any queries. I've been your host, Bari Michelle. Until next time, stay safe and stay healthy. I will leave you with the Healthy segment.